Hello, my name is David Carter. I'm here to teach you about delegation. Okay, the name of my project is Delegation, delegating tasks to appropriate personnel, the who, what, when, where, why, and how. Right here, I have a handout that I'm going to give my audience, which is my niece, Micaiah Carter, and my son, David Jr. This is by the National Council of State Board of Nursing, and it's a decision tree that nurses should follow whenever delegating tasks. Now for the start of my presentation. Next slide, please. So, who can delegate? According to the National Council of State Board of Nursing, which is the NCSBN, the American Nurses Association, which is the ANA, registered nurses can delegate, all right? The RN can, when appropriate, delegate tasks to LPNs, LVNs, nursing assistants, and other assistant personnel, which is like UAP, which is unlicensed assistant personnel, or even other RNs. So in certain cases, you may have to delegate tasks to other RNs. Okay? Next slide. What is delegation? So what does delegation mean? Delegation is defined by Merriam-Webster Dictionary as the act of empowering to act for another, the delegation of responsibility. That means that I have a task, I'm empowering you to act for me on my behalf to do a responsibility. Delegation in nursing is an art and skill that improves work performance and patient outcomes if done correctly. So if you do this correctly, you can improve efficiency, and which will help get tasks done in an appropriate manner. The ANA defines delegation as transfer of responsibilities of performance of tasks from one individual to another while retaining accountability for the outcome. And by that, it means that even if you give this task to someone else, the person who is delegating that task remains accountable. It means that if something goes wrong, that's the one that's going to get in trouble. All right, next slide, please. When to delegate. In order to know when to delegate, it requires the RN to make an assessment. They have to determine when is it appropriate for the LPN, nursing assistants, or other assistant personnel, such as the UAP, or even other RNs to perform a task. So you're gonna have to see more than just what needs to be done. You need to know your personnel, okay? Next task. Where to delegate? All right. Every state is different. Every facility is different. So first, it is crucial to understand that states and jurisdictions have different laws and regulations about delegation. And the responsibility of all licensed nurses to know what is permitted by their Nurse Practice Act, which is your NPA, rules and regulations and other policies. Like I said, each state or facility is different. And within this, you have different roles and responsibilities. You have an employer nurse leader role, you have a delegatee role, and you have a nursing role. All of it is centered around public protection. So all you're trying to do is get a task done and protect the public at the same time. And as an employer, you have to identify a nursing leader, determine the nursing responsibilities that can be delegated, to whom, and what circumstances. So you have to know your personnel as a nursing leader. You have to develop delegation policies and procedures. So you have to write something down by law that's going to protect you legally in the case of delegation. Periodically, you're going to have to evaluate the delegation process. So every so many years or so many months or every so often you want to go in and look at your policies and procedures, see if they're working, and see how you can tweak them to work. You want to promote a positive culture and work environment. You don't want your workers to be disgruntled. You always want to have a positive work environment. As a licensed nurse, you want to determine the patient's needs. So that starts with the nursing process with assessment. You want to have to go in and assess the patient, see what the patient needs. You want to assure availability of the delegatee, the person that you are delegating your responsibility to. You want to make sure that they're available to do the task. Do they have other things to do? You need to know. You want to evaluate the outcomes and maintain accountability for delegated responsibility. So whenever the UAP or other LPN or whoever you have delegated to, you want to go back and evaluate and make sure that the task has been done correctly. And as a delegatee, you want to accept activities based on your competence level. So you don't ever want to perform tasks that you're not competent in. If you don't feel comfortable doing it, do not do it. You want to communicate that using your two-way communication process back to your LPN. All right? You want to maintain competence for delegated responsibility. So if you don't know a task, learn it. If you having problems with a task, try to do more training. You want to maintain accountability for delegated tasks. And see, the training and education and the two-way communication is things that they must share with the nurse leader or the nurse who has delegated the task. Another thing that has to be done is communication information about delegation process and delegatee competence level. So if the nurse gives the UAP a task and they're not competent, they need to communicate that to the nurse leader so the nurse leader can train the UAP, and it's all to protect the public. All right, next slide. Why delegate? As you can see in this picture, you have one nurse, 1, 2, 3, 4, 5, 6. You even have patients up under the bed. So you have a high patient to nurse ratio. The goal of nursing should be to provide safe and caring environment that promotes patient health and well-being, including patient ratios. Increasing patient ratios causes dilemma. So what's the answer to your dilemma? Delegation. Next slide, please. How to delegate. This is the 5 rights of delegation. Whenever you're delegating, you want to make sure it's the right task, the right circumstance, the right person, the right direction or communication, and the right supervision. And this is the explanation. Under the right task, it says tasks can be delegated to specific patients as long as each task is within a delegated position, description, and covered by organizational policies, procedures, and protocols. The limit of activities to be performed must be delineated. Under the right circumstances, the complexity of the activity must be within the scope of practice of the LPN or LVM or within the position description of the UAP. An appropriate supervision of the activity must occur. The right person, the nurse must ensure that the standard of practice, licensure laws, educational requirements, and competency requirements for delegatees are met before delegation of the task. All nursing personnel must take responsibility for their own professional development and continual education. The right direction and communication. Nurses must provide definitive communication of expectations, whether written, oral, or direct care delivery. A clear description of the task, the expected outcome, limitations, and expectations must be communicated to the one you're delegating to. Right supervision. The nurse must provide monitoring and intervene as needed including employee evaluation and feedback. Next slide, please. So, what you do not delegate to UAPs. These are some of the things that you're not going to delegate. You never delegate assessment, teaching, medication, evaluation, or an unstable patient to a UAP. Next slide, please. Do not delegate this acronym, which is EAT, to an LPN. EAT stands for E, evaluate, A, assess, or T, teaching. Whenever you're evaluating, assessing, or teaching, you do not delegate it to an LPN. Next slide. So now, I have questions. I want you to answer. Can you delegate a new admit to a UAP?
No, you cannot.
All right. And why can't you delegate it?
Because assessment is needed.
All right. Can you delegate vital signs to a UAP?
Yes, you can. Because that is something that is always stable and the UAP is competent to understand.
Now, the only time that vital signs will not be considered stable is when it's an initial assessment. The first time of assessment should always be done by who? The RN. Okay. Can you delegate a discharge to an LVN or LPN?
No, you cannot, because teaching is needed.
Okay, that's a good job. Now, do you have any questions?
No, sir.
All right, that concludes my presentation on delegation. Thank you for listening.